Thank you so much for joining us, Dr. Masuku, this morning. Before we speak about the provinces or the health department's needs in terms of personal protective equipment, just let's look at the numbers specifically. Latest numbers showing 1,585 nationally, the cases of COVID-19, 693, as I've just mentioned, in Gauteng. But you obviously drilled down into those figures in the province itself. What can you tell us about the latest figures and statistics that you have with regards to COVID-19?
Yes, good morning and good morning to your viewers. We still see the same pattern. You know, the disease pattern of COVID-19 has always been have taken an urban spread. You know, Johannesburg will have the highest, followed by Ekurhuleni and then Tshwane. Both our rural parts of, or what we call economically deprived districts, your Sidibeng and Merafong, still have got the lowest. But one thing that is interesting with our statistics is that the West Rand has got 2 deaths. The deaths that we have, the 2 deaths that we have in Gauteng, they actually have occurred in the West Rand. So that's the most interesting aspect of it. But the numbers in terms of infected cases, Johannesburg still is the leading actually region about it.
Now, on a national level, we've seen a ramping up of testing. We saw those mobile test vans that was launched by the health minister just last week. What is the state of play in Gauteng in terms of testing at the moment?
We are, doing a lot of screening, because remember, we still have to follow that particular logic in terms of who do finally get to be tested. And the screening part will also be improved when we get the rapid test kits that have been, that are actually awaiting to be approved by SAPRA. Then it will actually increase our uptake in terms of those who need actually or who require testing. But we started last week in Alexander. We learned a lot of lessons that we need to improve in that space on how we can be able to do it. But also considering some few aspects about when you find a majority of the people in a community being positive, what do you do? So those are the things that we are considering now, whether we have to lock down a community or we have to remove them if they are few for trial isolation or quarantining.
You've made a special request, a plea really, for donations of personal protective equipment. PPE is something now that we now use every day, a phrase that we didn't know of really before COVID-19, as well as ventilators. Explain to us what you need and how people can help.
Remember that we are trying to get as much as possible the equipment, the PPE. We've always made the issue and the fact that, it wouldn't be a very good thing to find that the community has got a lot of these masks or PPE, whilst you find that health workers don't have. So this is just part of a drive to try and encourage people to give us more and offer us more, whilst we also do a particular purchasing and procuring. Our aim is to get to a point where we've got enough of this, particularly a stock that can last us at least 6 months. And that's what we are in a period of doing now.
If people are watching right now, perhaps they are just individual citizens, but perhaps they are CEO of businesses or involved in NGOs that can help. How can they go about getting in touch with your department so that they can lend a hand?
We have a specially arranged email where they can make contact with with us. It's actually having somebody who runs it 24 hours. The email is covid19.donations@gauteng.gov.
covid19.donations@gauteng.gov.za, and the phone number I have here is 072-633-0515. Now, MEC, before I let you go, your department is preparing for an increase, as we see the numbers going up, an increase of COVID-19 patients to deal with. But at the same time, hospitals, we believe, are dealing with people coming in. They feel like they're symptomatic or they're just not sure what they're feeling and they need to be helped. What is your advice to people to ensure that our our medical workers aren't overwhelmed during an already busy and stressful time?
Yes, we do have an app that we will request a lot of our people to download, which is zero rated by all our telecoms companies. Our app is called Mpilo app, which will give you an indication and a direction. It has got self-screening test questions, which will help you and direct you on what you actually need to do. So we would actually call upon all our Gauteng actual citizens before they visit a facility. They need to do that self-screening test, which will help you to even give you guidance on what to actually to do. If you're required to go to a facility, to also tell you that you have to go to a facility, or the contact tracers will make contact with you because it also helps them to geolocate where you are. So we will call upon Gauteng actual citizens to get hold of Mpilo app, which will help them to follow up, and even has information about coronavirus, answers a lot of frequently asked questions, and it gives a lot of information about where we are with the COVID-19 fight.
Well, that certainly does sound helpful. Dr. Bandile Masuku is the MEC for Health here in Gauteng. Thank you so much for your time this morning. And again, that email, if you're able to help, the call from the Health Department here in Gauteng for personal protective equipment as well as ventilators, you can email covid19.donations@gauteng.gov.za.